The professional boards under the ambit of the HPCSA are concerned about some of the registered health practitioners who are not complying with mandatory continuing of professional development requirements. Health practitioners are required to continually update their professional knowledge and skills. The Health Professions Council says it has embarked on a campaign to help practitioners become aware of this legislative requirement. Let's speak now to Mpho Mbodi, who's the head of the professional practice at the HPCSA. A pleasure to have you on the program this afternoon, Mr. Mbodi. Firstly, can you provide us some insights into the importance of continuing professional development for registered practitioners in really ensuring high-quality healthcare delivery?
Thank you, Tata. Once more, good afternoon to you and your listeners. The continuous professional development programs of the Health Professions Council is not only to ensure that registered practitioners maintain their knowledge, skills and performance, but most importantly, this program ensures that the patients or the clients who are on the receiving end of the health service interaction do benefit from more advanced and recent and knowledge and skills, so that the health outcome that they are expecting from competent practitioners do undertaken.
So there's also a mention of the importance regarding the mandatory nature of the CPD requirements for registered health practitioners. What are some of the common challenges or even barriers that practitioners face in meeting these requirements, and how is the council addressing them?
Well, there are a number of challenges that the practitioners report to be the bottleneck or the hindrance for them to comply. Some says that the access of the programs is very limited, especially those that are in remote areas where they are practicing, but others are still citing cost to be the main challenge for them to access. So the Health Professions Council in that regard has increased the access in terms of online reach and practitioners can access those entities that are outsourced in terms of delivering and facilitating the program, so that everyone at all times who needs to be gaining access to this does not find it to be a problem. But on the other side, the Health Professions Council also embarks on its own CPD programs to raise awareness about issues that pertain to the practitioners themselves from the regulator's perspective. And when those unfold, CPD points and access in that regard is being improved from the HPCSA side. So that is how we are trying to address this issue. Exactly.
Mr. Mbodi, the emphasis on the role of ongoing professional development in maintaining these high standards of healthcare is also highlighted. How does the CPD program then specifically contribute to enhancing the competency and ethical conduct of healthcare professionals?
Thank you, Nkandla. Remember, this program called CPD, it is the program that kicks in only when a practitioner is now fully qualified. So anything that relates to the practitioner's engagements in the training programs before they are fully qualified and independent within the registers of council does not relate to CPD. As they qualify, as we all know, that the technology is improving, practice is improving, even the processes themselves of how practitioners should engage with their patients is advancing at a pace that is very rapid. On that regard, it is very critical that practitioners does not only know what they were taught years ago when they qualified, but they keep up and they update their knowledge, skills and experience in order to maintain that performance, because everybody who has got an interaction with the health practitioner is expecting to be receiving the best care from the best experts. And then CPD is also there to assist that we keep up with the pace, we keep up with the advances on whatever profession that is applicable to the registered practitioners.
So let's speak about non-compliance with CPD requirements. It can result in various consequences, this including the suspension from practice. Can you elaborate on the measures that Health Professions Council employs to really support practitioners in meeting CPD obligations and also preventing instances of non-compliance?
Well, one important intervention that the council is is embarking on relates to the awareness to make sure that each and every practitioner who's registered, irrespective of the level and the type or category of registration in terms of their profession, everyone must be aware of the importance of CPD, because as you have already mentioned, this CPD program, non-compliance thereof, can result in practitioner suspension. The answer is not only suspension of practitioners that can be the consequence of or penalties of non-compliance. So it can be that sometimes the practitioners can be asked to rewrite the board exam just to satisfy the council that they are still practicing with the expected knowledge of competency, but otherwise any other action that the professional boards where practitioners is registered, it can be undertaken to make sure that the issue of competency is addressed. On that regard, in terms of the Health Professions Act, makes sure that everyone knows, especially that this is a legal requirement before any action is undertaken. And the structures within the HPCSA also embark on their own CPD interventions to help practitioners to gain knowledge free of charge without any cost attached to the activities, so that those that are unable to access the cost that is needed to reimburse providers, then they can do so from the ambit of the HPCSA's structures itself.
Mr. Mbodi, let's speak to the opportunities at the HPSA. How does the Council ensure that CBD, or rather CPD opportunities are diverse and accessible to cater to the needs of different healthcare disciplines?
Yes, there are numerous opportunities. In fact, the CPD program of the Health Professions Council is one of the most diverse. And Danta, you will know that practitioners, as they are working, wherever they are working in any form and type of facilities, they engage in these professional specific activities and engagements. As an example, if the practitioners gather at Hospital X, just as an example, and discuss a case, specific case relating to a disease or diagnosis that they are managing, if that activity is pre-approved and recognized in terms of CPD standards, practitioners can get their CPD right there and then. And that discussion, if it's ongoing, then practitioners can easily attain compliance. But that is just one part of how practitioners. The list is very comprehensive, as I indicated, including when there is lecture, seminars, conference type of attendance, workshops, those kind of things. As long as it relates to the practitioner-specific profession, it can be recognizable, including those formalized programs. Maybe somebody starting a postgraduate, something in the professions, that is also recognizable. So in that regard, the Council is making it as easy as possible for practitioners to be compliant on any activities that pertains to their professions when they engage in them.
So in the context of the evolving healthcare landscape, how does the Council then adapt the CPD guidelines and also its requirements to reflect emerging practices, its technologies and advancements in the healthcare sector?
Well, the HPCSA is very aware of all the improvements and changes that are occurring in terms of the healthcare space. And we are always on the lookout for how the CPD program not only can meet international benchmarking standards, but also can be relevant in the context of local South African healthcare space. Because as you are aware, the healthcare system in South Africa is quite unique. So we are always on our toe to make sure that the program, whatever reference that drives the CPD program, including the Act, the rules, the guidelines, that we are always maintaining them and constantly updating so that we don't lag behind. As you may be aware, the regulatory space should not be lagging behind from what the practice is actually evolving out there. So in that regard, we are always on top to make sure that we update. And the guidelines themselves, the one that gives detail as to what can and cannot be done in terms of the CPD guideline, CPD program, were just recently updated, I think, in 2023, just to make sure that we are still relevant in that regard.
Mr. Mbodi, as we wrap up our conversation, but also looking ahead, what initiatives or even strategies is the Council considering to further enhance the effectiveness and also the impact of the CPD programs in really supporting the professional development and regulatory compliance of healthcare practitioners in this country?
Well, the most important thing is that the HPCSA does not work in isolation. Even though the CPD program is being driven from the Council's perspective, there is a very strong need and desire for multi-stakeholders engagements that are involved in overall healthcare delivery in South Africa. This program cannot work on its own. For example, we drive it from the HPCSA side, but practitioners are employed elsewhere. So which means that we need to work with the employers to make sure that whatever programs and initiatives that they are embarking is also aligned with the professional expectations to drive this competency of the practitioner. So in that regard, there is a need for multi-stakeholder engagements, but most importantly, practitioners themselves should never be forgetting that the CPD compliance is not only about them as practitioners. Even though the competency and skills will be enhanced, the end product of what they are delivering as healthcare practitioners impact on the patients. So those patients and clients are trusting that any practitioners who interact or engage with them will deliver the best care possible at all times. Hence, this compliance is very, very crucial.
Thanks to our guest. That's Mpho Mbodi. He's the head of Division for Professional Practice at the HPCSA, for really shedding light on the imperative role of continuing professional development for registered practitioners in South Africa.